Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us this afternoon as I receive the very important report from the Delaware Pandemic Resurgence Advisory Committee. I have the leadership of that committee on the screen with me, and they're going to share some of their thoughts, highlight some of the recommendations of the committee. And first, I want to thank each of them for their leadership. This is, this has been an unprecedented time in the history of our state, the history of our country. We haven't experienced a pandemic like this in over 100 years. And so through the first 7 months, as we've met the challenges of the pandemic, we were really working through uncharted territory and waters, if you will. And so anticipating that things would change as we moved into the fall, particularly as we approached the new flu season, we needed to really hear from the expertise of our business community, of our health community, of our small business and associations, and hearing from an equity point of view. And so the Pandemic Resurgence Advisory Committee was established to provide us that kind of input, broad input from many players across Delaware, geographically and in terms of business orientation, and with a special focus, of course, in terms of the health of the community and how we could keep Delawareans safe through this next phase of the pandemic. It was very challenging in the spring. We were motivated mostly by concern for everybody's health and frankly, fear of what could happen, fear of the unknown. So it was difficult to close down sectors of the economy. It was difficult to close our schools. And we did so, really made those decisions in cooperation, communication with all these sectors to protect the health of every Delawarean and to address the pandemic in a way that we could recover ultimately in the long term. It's been even more difficult, frankly, to address the challenges of reopening, knowing when to do it, what the conditions needed to be on the ground with respect to the health of our communities, whether we're protecting unique and vulnerable communities here in Delaware, and what we ought to focus on and things we ought to do going forward. This advisory committee has just done a tremendous job in coming up with a series of recommendations that we ought to follow, many of which, by the way, we are putting in place as we speak, and we'll highlight that as we go through. And so I want to thank each of the leaders that are on the screen here, particularly our Lieutenant Governor and our Secretary of State, who were the co-chairs. Of course, Dr. Nancy Phan, who headed the Health Subcommittee, Eugene Young, who headed the Equity Subcommittee, and Katie Wilkinson, who headed our business community. Obviously, a tremendous focus of all of our efforts. And so with that, just as a brief introduction, I'd like to turn it over to our Lieutenant Governor and our Secretary of State, the co-chairs, to talk a little bit about what the work of the committee.
Thank you, Governor. It's a pleasure to join you. And I know for my incredible colleague, our Secretary of State, Jeffrey Bullock, today is an exciting day to give to you our final recommendation from the Pandemic Advisory Committee, the PRAC. Kind of seems like yesterday, and sometimes it seems like 2 years ago that we gave this to you 2 months ago. As you indicated, sir, it has been a pathway. But before we start, we want to thank you, sir. Individually, you have given tirelessly to the state, standing up, trying to protect all the Delawareans, and also to your incredible cabinet and your team, the hours that you have given. Thank you so much for your leadership. And I know every day our committee chairpersons who worked on this heard from and had at the forefront our frontline workers, our essential workers, those who gave so much. And as we turn over the PRAC to you today, we are thinking about the over 600 and some Delawareans whose lives have been lost. So it's in their honor that when we came together, we really put first thinking about what's worked, what lessons have we learned, and then what do we need to do better. When we talked at the end of July and gave you the report, we knew we'd make some additions, and we have. And it's been based upon those 3 buckets that you laid out so clearly in your executive order. And I wish we had time, sir, to introduce you to all 46 members They really are experts in the field. They're leaders, they're legislators, there's members of your cabinet, and they're just really good basic community members who care about Delaware. And we have broken them into health, business, and equity. And as you indicated, we're going to hear from Dr. Nancy Fan around health, we're going to hear from Katie Wilkinson around business, and we're going to hear from Eugene around equity. But at that whole foundational level, it's what you've said, what we've all said, got to have a healthy community to have a healthy economy. But at the base of that, we've got to protect and have equitable distribution of care and services, particularly for our most vulnerable, whether it's our homeless, our veterans, and our communities of color. That has really driven us. And so you'll see in this report some really awesome short-term goals, and some of which you indicated we've started down the path of addressing, and others that are a little more aspirational, a little more long-term, that are going to take us a little time. But I know we've got some of the best and brightest people here committed in this state who are going to make sure it happens. And so I know it's a joint accountability component. And before I turn this over to my co-chair, I do just want to indicate the thanks to your incredible staff who've worked behind the scenes with us, the Secretary of State staff, my office, and to Boston Consultant Group. They have kept the fuel to the fire. They have made sure that as we come forth with these recommendations, sir, that we hit the ground running. And you have my commitment, as I know Secretary Bullock's, and everybody who's joined in, it's not going to sit on the shelf, that this is truly a pandemic playbook, that hopefully all other areas across the region, and not only our region, across the country, are going to see that Delaware can do things well and we can do things right. And so before I turn this finally over to Jeff, I just have to say we are committed. We're going to make sure that these get carried out. And just a quick highlight, I know that you're going to hear more about this from the committees. You've already started, working with our county, our local municipalities, our federal partners. You have started down that path with the Delaware Relief Fund, looking at our workforce development, looking at housing and mortgage assistance, and also our broadband, significant investment. So we have telehealth so that we can educate our children. Again, thank you for the leadership that has started down that pathway. And the final thing I'll say, I would be remiss during this pandemic if I did not mention, as a nurse, the social and emotional impact this has had on our community. And again, thank you to the many partners in the health systems who have stepped up, but in particular, Department of Substance Abuse and Mental Health, for going out, putting a ban in the communities where people are suffering the most with the opioid epidemic during this pandemic. So a lot of stuff has been said. I don't want to speak anymore. I'd like to turn this over to my incredible chair, who I've really enjoyed working with, who I know is probably going to touch on a few of those things that I haven't. And so with that, I'm going to turn it back to my colleague, Secretary Jeff Bullock.
Thank you, Lieutenant Governor. She basically said everything I was going to say. And so leaves me a little bit short here, but let me just echo a couple things and reemphasize a few things. Number one, Governor, and thank you for your time as well today. This is a really great group. And I say that having had nothing to do with putting it together, because that was your work and your staff's work in assembling this task force. And asking Bethany and I Bethany and me to participate. But it is probably the most talented group of people on this kind of task force that I've worked with in my many years of state service. And that, as you know, is kind of a double-edged sword, because on the one hand, they come up with great ideas and great recommendations. And on the other, they are fiercely opinionated. In what they believe is right and good, and how we should move forward as a state. And I think you'll see that reflected in this report. It is written in a way that offends no one, I think, which it should be. But at the same time, it lays out, as the Lieutenant Governor said, a very clear path forward about how this task force, anyway, believes we should handle the pandemic and should there be a resurgence in the pandemic as we move forward. It is very much a model of shared responsibility or shared accountability, as we like to say, because we realize now, as I think we did 6 months ago, but we know even more now, that we are literally all in this together. And as you like to say, Governor, this is a really big deal. And there is no way that we will get out of it without finding or continuing to find ways to work together, both to keep each other safe and also to make sure that that our economy is allowed to rebound and flourish once again. There are some areas where we have paid particular attention to, and I know Eugene will touch upon some of these as well. And they go, and you and I have had this conversation already about how we communicate to various communities in our state and how we do a better job of that, not only for now, but as we continue to do a better job and build trust with a look towards the future when God willing, we have a vaccine and we begin to distribute that vaccine across our state. And so in closing, I just say again, thank you for the opportunity to serve with this very, very special group. And you and I and Lieutenant Governor and everybody on this call, we've all been on a lot of task forces. Government is good at that. And we know that a task force is only as good and the report is only as good as our ability to implement it. So we trust that you will take this report, read it carefully, take out the best parts, and as Lieutenant Governor said, start implementing sooner rather than later. So again, thank you very much. I'll turn it back over to you, Governor.
Well, thank both of you for your work and your leadership. Secretary Bullock, to say this is the strongest and best group that you've worked with during your career in state government is saying something, because you and I go back almost 30 years in doing that kind of work, and there's been some really good groups looking at all the various issues involving challenges that we face in state government. And there's been no challenge, as you say, more difficult and more challenging than this because of the unknown nature of the disease, the virus in the first instance, obviously public health guidelines. We have learned an incredible amount. We've learned that it is really, really hard to strike the right balance between the health of the community and the strength of the economy. But it's not an either or proposition. It has to be both. And so getting the best advice from representatives of the health side of the equation and the business side of the equation, which we're going to hear from next, while factoring in issues of equity and vulnerable populations is extremely difficult. What I've learned is we know what works just by watching the experience of other states across the country and the approaches that they have taken and the ones that have worked and the ones that haven't worked so well. Here in Delaware, we've tried to strike that right balance. Your recommendations, I think, are geared towards that. And again, to each of your committees and the work that they put together, really do appreciate it. And why don't we start, because you have to have a healthy community first before you can have anything else. Why don't we start with Dr. Nancy Phan, who is obviously a physician. She's also the chair of the Delaware Healthcare Commission, and on her spare time was chair of the health subcommittee of this PRAC. Dr. Phan.
Thank you, Governor. And I echo a lot of the comments that Lieutenant Governor and also Secretary Bullock made as far as the amount of support that your office and their offices gave to make this work possible. I also truly have to commend the governor for his amazing grasp of the science behind this and leading our response, our initial response with science and putting public health as that forefront priority and being able to move forward and treat this pandemic as the serious issue that it really is and still is, continues to be. And I really feel like my subcommittee members took that to heart and wanted to make sure that we had the lessons learned from the first few months and how to translate that into making it much more successful if there is a resurgence. And having said that, I really, really appreciate and deeply in amazement at the scope of knowledge and experience that my subcommittee members have brought and the commitment that they've given to this report. So I want to thank them. I want to thank the support that we got from your office, especially through Joe Bryant and BCG first. Having said that, we had 12 recommendations in the interim report, very, very robust recommendations on, first of all, the most immediate action item, hopefully that we can get started right away with, is that nimble, small working group of healthcare stakeholders who can help us respond quickly in all aspects if there is a resurgence. And then as far as testing, that ongoing quest to improve testing, make testing broader, testing version 2.0, version 3.0, 4.0, always searching to make sure that we're able to obtain the data that will support the work that needs to get done. Once again, talking about the PPE, keeping everybody safe and protected, also about communicating, not just about our personal protective equipment, but also about how you can mitigate and decrease the risk, especially as we reopen and we see broader communities. And as people go to school, we heard a lot of feedback in our public feedback about those two particular comments. How to have accountability, how to have communication, and where is that testing? Where is the data that's going to help us move forward? So we took that to heart when we went from the interim report to the final report in our recommendations. We also talked quite a bit as we had our meeting in between the interim report and looking at feedback. A lot of the public comment feedbacks about financial resilience and making sure that our healthcare industry stays healthy. Not that they just stay protected, but how do we protect the workforce, the capacity, how do we meet any shortages, and also with all the funding that is available, how do we make sure that funding is accountable, make it transparent, make it that it helps with financial resilience of our healthcare community, but also align it, like the Lieutenant Governor says, a little aspirational. How do we align it with our long-term healthcare goals? And, you know, as chair of the Healthcare Commission, that really struck with me. How do I improve healthcare delivery as we move forward from the pandemic and learn those lessons? So those are just touching on a few of the points that we felt we could refine. The really reassuring part was a lot of the comments we got was in the robust content under the recommendations that we had. Within our 12 recommendations, we didn't really have to tweak too many of them too much because a lot of the information was already there. So I think everybody's ready to move forward and to really implement some of the recommendations from the immediate actions to even some of the long-term actions. And I look forward to being able to work with all our subcommittee members as well as the wonderful co-chairs from the other committees. So. And Doctor, I keep calling you doctor because I think you've earned at least some part of a degree here. Back to the governor to see what he thinks about that.
I at least want a master's degree out of the last 7 months, that's for sure. Well, you mentioned testing, and it has been an area of focus and an area of considerable improvement. You know, since I asked AJ Shaw to become our testing czar. You mentioned innovation and testing technology. We've seen incredible changes and innovations that have enabled us to test as many as 15,000 people a week. Aspirationally, we wanted to do more than that, and we continue to do that. We have lots of different approaches to it today, including testing oneself at home, which is about, frankly, as easy as it can be. We do know that we're moving into flu season. One of my earliest concerns was our hospital surge capacity, as we started to see those hospitalizations increase in April. We peaked at about 337 in the hospital on April the 27th. And we know in a normal flu season year, I'm told that we could have that many who are hospitalized with the flu. And so if you combine that with COVID-19 hospitalizations, which right now are at 64, you're talking about a number that, again, is approaching capacity there and a big concern. And then the equity issues, which we're going to hear about next, certainly for the long term. You know, this pandemic has exposed health disparities in our state that we've had for a long time, and ones that persist and make those populations more vulnerable when they get COVID-19. And so Eugene Young, who's the president of the Wilmington Urban League, did chair that equity subcommittee. We appreciate his work and that of the subcommittee.
Thank you. Thank you, Governor. Thank you also, Lieutenant Governor Hall-Long and also Secretary Bullock. I really appreciate the opportunity to work with so many amazing people in the subcommittee. I would like to thank also my other committee chairs, Katie and Dr. Nancy Fan. It's been great working with you guys. Also, this is something been interesting for me personally because connecting all these different dots, right, around the health, around the economic side of everything. So I cannot thank you enough. And I want to also give, I feel like I'm giving a lot of thank yous, but I mean, to pull something like this off, you need to give a lot of thank yous. And another to Siobhan White, who's done an amazing job from the governor's office, and also BCG, and most importantly, our amazing subcommittee members who've done an extraordinary job, giving a lot of their time, their talent, their energy in order to get this across the finish line. So I'm indebted and I'm thankful to you all. We did not have any major changes to our recommendations. As one of my subcommittee members said, Ms. Maria Matos, who we all know well, she said, you know, we don't have that many because we did what we should have done in the first place. And
Sounds like
I think
Maria.
that sounds indeed.
You got it right the first time around.
Yeah, indeed. So we're pretty exhaustive with our efforts. And one of the things that, you know, as we take a step back and we look at the recommendations, we're glad to see some of, I mean, even during the process where we're coming up with these recommendations, you have things such as the Delaware Relief Grant Program that comes out for small businesses. So that was great to see, especially working with Secretary Bullock and Damian and others about how do we target minority businesses up and down the state. I'm sure Katie is going to get into that just with the grant program itself, but our job is to make sure that we focus in more on how we can assist and make sure we get more minority businesses, small businesses to the table to be able to take advantage of these resources. And we have a great group of individuals within our subcommittee that are helping along those efforts. Also, one of the things I remember from a subcommittee member was when we spoke about the housing and the lack of access to resources in order to continue, you know, people struggling with evictions or foreclosure. And it was great to hear our Delaware State Housing Authority Director Anas Ben-Adi say on our subcommittee call almost 2 months ago that as we move forward, you know, with the funding that is had through the programs that he has, that no one should be out of the home due to COVID-19, no one should be foreclosed or face eviction due to the programs that the state currently has available. So being able to have that information and have individuals that are working diligently behind the scenes in order to get things done helps our subcommittee in moving forward. As we approach the fall, one of the things that we've really wanted to touch on is, you know, and I've said this before, and I'll be a broken record, is testing, right? We are so concerned as we touch into the fall and into the winter with, as you just said, Governor, around flu season, how important testing is going to be in many of our already hardest hit communities. We've had great discussions, Zoom conference calls with many community members across the state, Sussex County, Kent, Newcastle, in Wilmington, Dover, all different areas. And talking about how the accessibility of testing, the different hours in testing, the availability of testing is so important to them and their families in moving forward. And that kind of, I would say, dovetails into, some of the things that we closed on. Even we just had a subcommittee meeting yesterday where we talked about, as we move forward, just the testing aspect, also the contact tracing, how important that is. I know Secretary Bullock brought up the trust aspect and the communication aspect. So that also became something that came forward from our conversation, just making sure that we have, as Dr. Hicks from our subcommittee would say, we have contact tracers that are from the community. We have people that are from these areas in Sussex County and Kent County and in Newcastle County that can be able to bridge some of these gaps. And also, we as a group, which was great, the group even decided yesterday that we want to continue meeting as a group, because one of the things that we had was we had great recommendations, but we also want to make sure that as things come up, we're able to provide inside advice. We're also able to work together as a cohort, in a sense, to bring ideas to the table, and also make sure that you all as government are able to hold us accountable in our connections with community, and we're able to continue holding you accountable, saying, hey, these are the recommendations. We need these things to get done on behalf of our communities and our constituents. So we're very appreciative of everything. We look forward to working with you all as we move forward. And I'm just, again, I'm thankful to everyone on this Zoom call, and I'm also thankful to all of the subcommittee members that helped to make this happen. So thank you so much.
Thank you, Eugene, and to your committee members as well. As I think back over the last 7 months, maybe the most difficult challenge that we faced was the COVID-19 outbreak among poultry workers in the lower part of our state. It was a significant outbreak, and it was challenging because of the impediments that we met with respect to some of the companies, as well as some of the federal agencies that made it difficult to work through that. In the end, though, working with our hospital partners, BB, Nanacoke, and even Christiana Care, moved there, and Bay Health to do testing. We tested thousands of workers, many of which spoke English as a second language, whether they were Latino or Haitian Creole. We tested their family members and community residents in the small towns there of Seaford, Georgetown, Millsboro. Our Lieutenant Governor had already been working with homeless populations across our state, and we touched into that network. And I think in the postmortem, of course, it'll be some time before we get to that point. I think people look back and say, well, that's something that worked, and it worked because we found those ways, Eugene, to get to communities with trusted partners to make sure that the public health messages sometimes were difficult, including moving people into quarantine hotels that we stood up so that they were protected from their families and members of the community. Throughout this whole thing, our focus has to be on making sure that we do everything we can to keep businesses alive. Many business sectors have almost all have sacrificed. Some have sacrificed a lot more than others. It's broken my heart to hear, mostly from restaurant owners who've had businesses in their family for 2 or 3 generations, who are looking at the possibility of losing their business because of the business sector that they were in, bringing people together to eat and drink in a casual congregate situation was not very good as it related to infectious disease control. And so we've tried to work hard with that organization, those businesses, and all businesses to communicate what we're trying to do and to get their input, make special arrangements for them to get additional revenue just to kind of get from here to the other side. And so the business subcommittee, Katie, was incredibly important as part of this initiative, and we appreciate your leadership at the State Chamber, at your bank, and as part of this, as the chair of the subcommittee on business.
Thank you, Governor, and thank you for your foresight in standing up this project, which is obviously very critical at this point in time in our state and relative to what's going on across the country. I'm going to save the rest of my gratitude for the end of my comments, but we did have a very engaged group. As Secretary Bullock indicated, no one was afraid to share their opinions, which were not always aligning. But it was very, very helpful. Everything was shared openly and honestly. We had strong representation from industry, from business leaders, from legislative leaders, and geographically spread across the state, which we thought was really important as we undertook this project. Similar to the equity subcommittee, we did not have a lot of additional comments between the interim report submission at the end of July and the final report, which you will get today. With the exception of a continued thread of communication needs across everything that we're doing. Starting with, sort of our primary goal, which I think is very much shared across all three groups. And that is that, with health in mind, to avoid a complete shutdown of the state again in the unlucky event of a resurgence. So that's sort of been in the back of everything we do, and sort of managing then through the communication and innovation of trying to stand up some good ideas to be able to help our business community. And first and foremost around that has really related to providing support and relief to small businesses and those that were disproportionately impacted by our shutdown, which obviously the health dynamics of that sort of required us to do it. The Delaware Relief Grants has been super exciting, standing that up, watching that come to fruition. We did have our first round, which opened in early September. Within 36 hours, it was closed. We've learned some things from that. We did take a large number of applications during that process, and I'm very, very pleased to say that today, about 740 businesses will receive over $25 million in relief grants today. The new round opens tomorrow. We've taken a lot of our lessons learned from round one to improve round two. There's still certainly plenty of CARES Act money that was allocated to this program to help facilitate the support of small businesses through this time and to help small business owners get back on their feet. Part of what we'll be doing around that is focusing on our outreach efforts to minority groups and to those disproportionately impacted, to make sure that the application process and the opportunity to ask questions and learn about the process is made readily available to minority-owned businesses, women-owned businesses, and veteran-owned businesses, amongst others. So that's certainly something that we're very, very pleased about. And Damian DeStefano and his office did a great job with our committee and are really working tirelessly on that Delaware Relief Grants program right now. Workforce development was another thing that was very, very critical for our group to focus on, getting Delawareans back to work. And one of the ways that we thought that might best be achieved was by upskilling or reskilling, which was certainly something that we talked about at the State Chamber as well early in the pandemic, is providing new opportunities for people to change their career trajectory to where jobs were available and people and skills were needed. So we've been very pleased to see the CARES Act money being pressed towards those efforts as well. And then lastly, one of the things on the agenda or on the additional comments was, again, this whole concept of communication, and particularly the ongoing demand of business owners for clarification, clarity, consistency, and rationale around decisions that are being made. And so, we're finding ways to continue to use health stats to help our business owners across the state understand risks, understand the decisions that they need to make in order to be able to stay open, serve their clients, and continue to function in this community. So it's been a really exciting project. There is more work to be done, whether formally or informally. Relationships were built. And I do believe that this group will continue to work together, whether we're called upon formally to do that or not, and hopefully to continue to move along the agenda for improving Delaware's economy and getting back to where we really want to be. So with that, I too would like to just express my gratitude again to you, as well as to Lieutenant Governor, the Lieutenant Governor, and to Secretary Bullock and their staff, and the amazing work of the Boston Consulting Group and your office's staff, as well as the committee members who gave a lot of time and energy and thought and communication to this project. So thank you so much for the opportunity. It's been really wonderful.
So you're exactly right, Katie. I mean, this COVID-19 pandemic certainly is an existential threat to so many businesses. There are actually businesses that thrived under it, but there were more businesses that sacrificed and sacrificed significantly. I guess restaurants and bars and hospitality in particular. And we have used CARES Act, and it must be said, a word of thanks to our congressional delegation, Senator Carper, Senator Coons, and Congresswoman Blunt Rochester, for working with the Congress and the President to make the CARES Act resources available. When I think about the CARES Act, which was, and the resources coming from the federal government of several $1 trillion, and compare it to the bank relief legislation that passed in 2010-ish, 2009 maybe, of $800 billion. It's, you know, these resources have enabled so many businesses and so many sectors, whether it's nonprofits, whether it's colleges and universities, to survive for some period of time. But to your point, our tools as we move forward are more limited. We need to learn to be able to manage the risk without complete shutdowns, which is one way to control the virus. And we have learned a lot. And some of those things are pretty simple, and they require very small sacrifices by each of us. And they're sacrifices to wear a mask when you're in public, to respect the health of our neighbors by wearing a mask in public when you go into a retail establishment. And as we try to get our children back into schools, to kind of follow the rules and the guidance there. Probably the most difficult thing and challenge that we have is to do that. But our work is going to be made easier. It's really hard work, but we've got great recommendations from the experts that served on each of your subcommittees. We're seeing a little bit of an uptick in our positive cases, and really that is a function of people letting down their guard, getting a little complacent. And when I think about the alternative, you know, a business person who's had a restaurant in our state for 50 plus years, and him or her looking at losing that business because our numbers are going up because folks are not wearing masks in public and the rest, they're not getting tested when they should. Those are small sacrifices with respect to the other objectives that we have. So thank you all for your efforts, the efforts of your committees to come up with those recommendations, many of which are really underway. When you're talking about testing, critically important, whether you're talking about small business relief, particularly for sectors hurt the most. Hear you loud and clear with respect to communication, Katie. I feel like I talk about this till I'm blue in the face, and it's not enough. We can always do better, and we can always engage more, and we will do better, and we'll win in the long term. So I do have this report. Usually we end these Zoom calls like this by me holding this report up and everybody else clapping, which is how you clap, I guess. Pam, is it clapping? There you go, clapping. And thank all of you for your great work.